Autism spectrum disorder is a neurodevelopmental condition characterized by early onset challenges in social interaction and communication, along with restricted repetitive behaviors and interests.
What's my name? My name.
According to global health reports, about 1 in 100 people live with this disorder. The U.S. National Population and Housing Census 2024 findings indicate that 179,072 persons aged 2 years and above are living with autism in Uganda. Out of this, 91,572 are females and 87,501 are males. Grace Nayiga, a resident of Kampala, is the mother of a 9-year-old child with both autism and Down syndrome. Her child was diagnosed with Down syndrome at 7 months and autism at 3 years.
When we went to the doctor, he did physical observation. Yeah, he looked at her eyes, he looked at her nose bridge, this part, and he said that it was a bit flat. And then there's some measurements that they did between the eye and the ear, and they determined that the way it was, the length, the line where the line was placed was typical of children with Down syndrome. At 3 years, we introduced her to a special needs school. And in the special needs school, she was assessed. So when she was assessed, they told us that they were seeing elements of autism.
She shares that raising a child with special needs has not been easy. She struggled with denial and grief, and some community members often attributed her childish condition to curses or a punishment from God.
There were actually instances, there have been instances when someone openly tells you that that's witchcraft, you know, and you need to do something about it. And that, in a way, brings judgment. So because of that fear, you find that you also do self-stigma. You inflict it on yourself. And then you find that you're not living openly, you're not able to take your child out.
Finding a mainstream school for her child was also a major challenge, with some schools refusing admission because they felt they could not handle her child's needs.
You can imagine walking into a school and being told that the management is not comfortable because they are not sure what the children will tell their parents when they go back home. That means that there's a lot of wrong perceptions around the condition within the public.
Nayiga is an advocate with Uganet, an organization that fights for the rights of people living with HIV and women. She says that having a child with special needs inspired her to expand her advocacy, including children with disabilities.
This experience, being a parent of a child with special needs, it's kind of strengthened my advocacy and my activism. And I found myself over time telling my story because one, I felt lonely initially and I didn't know who to turn to for support.
Dr. Emmanuel Mwebe, an occupational therapist specializing in special needs, says the causes of autism are still unknown. However, he highlights some of signs and symptoms to watch for, such as delayed speech or difficulties in social interaction, and emphasizes the importance of early intervention.
Mother or the parents have noticed that this child might be having a problem. They go to the hospital and we carry out an assessment. Ours takes 2 weeks of observing the child. This assessment helps us to know that really the child is having autism. Secondly, what are the strengths and the weaknesses, the areas of concern, where we have to start from.
Both Nayiga and Dr. Mwebe urged the government to increase awareness and support for individuals with autism and to develop policies that assist parents raising autistic children.
The bills, the medical bills, the caregiving, the schools that we have to access, the therapies are extremely expensive. But if we have a law that lifts some of those burdens off mothers, I believe that mothers and parents with children like Talia can be able to thrive and also contribute to the development of this country.
For having these children grow and we don't know where to send them, at least we have known This child can be a carpenter, this child can be a swimmer, this one can do computing, but the rest of the schools which are professionals in those areas are not ready to take in these children. So we would urge maybe the government to put an emphasis on that if this child has this, maybe can be accommodated here.
Dorothy Najita, NTV Tonight.